To that point specifically, Mr. Kennedy, when you're talking about barriers on creativity and entrepreneurship, et cetera, healthcare is repeatedly raised by people, small business owners, et cetera, as one of the largest costs they have when they start a new business. And of course, Medicare for All was such an animating force of the last two Bernie campaigns and really galvanized a lot of previous non-voters and disgruntled Democrats into a movement. You said in a recent interview that you were for Medicare for All in theory, but that you found it, I believe it was something along the lines of politically unlikely, something to that effect. I don't mean to put words in your mouth. But it strikes me that some of the other things that you've been fighting for, I think really valiantly, like cutting the military budget, taking on the military-industrial complex, are also things which will face intense pushback from the blob, from these deeply entrenched, very well-funded industries. And that being said, given the obstacles to fighting the military-industrial complex, what do you say to progressives who are disappointed that you don't seem to have that same urgency with respect to healthcare, which is repeatedly ranked as such a significant concern for Americans, and Medicare for All in particular, which 88% of Democratic voters support?
Yeah, well, let me answer both, all of your questions. One is just from a practical standpoint, Brianna, in terms of cutting the military budget, it's easier for a president to do than passing a national healthcare program. And a lot of those costs that, the president can do on his own without that much cooperation from Congress. And that's why I think of course you're challenging vested interests that are as powerful as the pharmaceutical industry and the medical cartels. But it's an easier thing. The president does not need to get 51 senators and 250 congressmen on board. And then, with Medicare, look, I watched my uncle and fought with him for 50 years trying to get national health care through. And I'm very conscious of the deadlock that he reached. And I am, if it were up to me, I would say we should have Medicare for all right now. The current way of funding Medicare is not of funding health care in our country is dysfunctional. What I would advocate is a public option, which will lead ultimately into Medicare for all, but give people individual choice. I'm somebody who is for personal freedom, for personal choice. And I think the public option is more consistent with that belief. And if we can make a public option that, for example, would charge a maximum of 8% of people's income rather than the 20% that they're paying today. If we can make that option work, and if we can make it attractive to Americans, you will naturally evolve it into Medicare for all. But you'll do it through a process of choice and evolution rather than imposing it on people with a lot of hostility, which is just practically impossible to do, as you probably understand. And I understand because I was involved in the healthcare battle for so long.
Well, can you speak specifically to what you think? I think
we need to think of it. I think we need to think, because we have to acknowledge these deadlocks, acknowledge these practical obstacles, and we have to think in terms of ways to unify Americans in ways that will reduce the overall cost of healthcare. The healthcare costs now in this country are $4.3 trillion. That is far higher per capita than any other country on earth. We pay much more than anybody, double or triple what people pay per capita in Europe or Canada. And our healthcare outcomes are 79th in the world. We're behind Mongolia, we're behind Cuba, we're behind Costa Rica in healthcare outcomes. And one of the reasons for that, probably the principal reason, in fact, the principal reason is chronic disease epidemic. We have the highest burden of chronic disease of any nation in the world. Why is that? Why can't we eliminate it? We know that it comes from environmental exposures. Why aren't we doing the science to identify what those exposures are and to eliminate them? that will eliminate a huge chunk of our healthcare costs and give us a lot more elasticity and flexibility in the way that we allocate those costs to, different actors within the system, which is really what you're doing when you switch from HMOs to Medicare for all.
Yeah, Mr. Kennedy, I do just want to push back and say that I think, for one, the continued presence of a private healthcare system undermines some of the savings that come through a Medicare for all style system by letting people opt out in a way that diminishes the pool that the costs are spread over. So that's one concern people have with that. But more specifically, you're such a vocal and persuasive critic of industry capture and the ways and the kinds of corruption that cause there to be such a disconnect between what the average American wants. 88% of Democrats and a slim majority, but a majority of Republicans all support Medicare for all. So when you look at Congress and say, well, Congress won't pass it, even though the constituents in those congressional districts want it, I think that what people are looking for is a leader, a president who exposes the extent to which elected representatives are not, in fact, representing the interests of their people, and that they feel pressure, therefore, to start to do that. And when they hear a presidential candidate saying, well, there are these obstacles, and so we're going to take another track, it makes some people ask, well, when are we ever going to get that Medicare for all? Yes, we have chronic disease, we have these other issues, but how long are people supposed to subsist and suffer and have medical debt and die, while we know overwhelming majorities of Americans all want one solution, and it is elected representatives, including many of those in the Democratic Party, that are standing in the way?
Brianna, I agree with virtually everything that you say. The issue is that I've been in the trenches for 50 years fighting on this issue, and it's an issue that is because of what we're dealing with in Congress and elsewhere. It's entrenched. It's a source of polarization, and I feel like I need to look at ways of solving this that are actually practical. So I would like to get to the same place you are, which is Medicare for all. But I think the path to doing that, and if you remember, Brianna, when Obamacare got passed, there was there were a lot of problems with it. There were a lot of glitches with it that made people very, very angry about it for the first 2 or 3 years. And then those glitches were slowly worked out. And the option that I'm proposing, which is to begin with the public option, will allow the glitches to be worked out in advance so that ultimately, when and if we get to Medicare for all, we won't have those times where people really get harmed by the implementation of a new system. So, I would say that's my best answer to you. I want the same thing that you want. I believe most Americans that want it. I think, listen, my uncle, I can't tell you the number of times that I was in Senate caucus meetings with him, in his office, talking to people, campaigning across the country, pointing out that this was the only country in the world, we're the only industrialized country in the world where people can work their entire lives and have their savings wiped out by a single illness, catastrophic illness. This is the only country in the world, industrialized country, where parents can sit in a living room and listen to their baby crying in the room next door and have to wonder whether that baby is $50 sick or $100 sick, $500 sick before they bring him to a hospital, and then have to make really difficult choices. And it's unfair. It's wrong. We should have Medicare for all in this country. The obstacle that I just recognize as somebody who's trying to deal with issues pragmatically is that it is, it's a, to put it mildly, a heavy lift.